So good to go, sir.
Good morning, good afternoon, good evening, based on which part of the world you're tuning in from. Thank you all for joining in for today's IVI Talks. IVI Talks is a monthly lecture series planned to channel thoughts, experiences, projects, and learnings of experts from different strata connected to eye health to the professional community. And I'm delighted we have Peter Holland here, who's going to speak on global coalitions and universal eye health. Achieving universal coverage in eye care continues to be a challenge, with large numbers of people in the world remaining visually impaired, the majority from avoidable causes. Limited capacities of health systems in low-income and middle-income countries to deliver effective eye care services are constraints that need to be addressed urgently. The International Association for the Prevention of Blindness, IAPB, is leading the action to change all of this. And I'm so delighted to welcome Mr. Peter Holland to speak in this session. Mr. Holland has been Chief Executive of IAPB since May 2018. He has also worked previously in the UK Foreign and Commonwealth Office, the National Health Service, and the Royal National Institute of the Blind. After 10 years developing primary care services in the National Health System in South London, Mr. Holland joined the FCO, where his roles included postings to India and Afghanistan, senior policy roles on counter narcotics and negotiating international intellectual property agreements. At IAPB, Mr. Holland is taking a lead at a global level to promote eye health and to ensure its critical importance to the delivering of UN Sustainable Development Goals. Over to you, Peter. Thank you so much.
Vinod, thank you very much. Let me firstly share my screen. Good. I hope that is working. So Vinod, thank you for the introduction. Mujaj मैं शामिल होने की बहुत खुशी हो रही है आपके निमंत्रण के लिए धन्यवाद. Vinod, thank you. I'm really delighted to join you today. As you introduced me, I'm Chief Executive of the International Agency for the Prevention of Blindness, IAPB. We're the overarching alliance for the global eye care sector, and we have members really all over the world. Vinod, as you said, I'm going to talk today about global coalitions and universal eye care. And obviously there's a huge literature around coalitions and partnerships. So I'm going to really talk today from my own personal experience, my experience of working of my couple of years so far in the international eye care sector, but also more broadly, some of the experience I bring in terms of working in coalitions and partnerships over my career. What I'd like to do today is look at three main questions. Firstly, why I think we need global coalitions in eye health and to achieve universal eye health. Secondly, some of the lessons that perhaps have been learnt from our experiences in building those coalitions, including drawing from some of my own experiences, many of them positive, but some of them not so positive. And then I want to look to the future and some of the challenges and opportunities that we face, and critically what the key roles of coalitions will be as we try to deliver universal eye health over the next decade. So let me first turn to why I think we need coalitions. I want to concentrate on three main reasons. Obviously, there are many reasons why people build coalitions, but I'd like to focus on three that I think are critical for us in the delivery of universal eye health. And these are the three reasons. We need coalitions to deliver at scale, we need coalitions for reach, and we need coalitions for influence. So let me take those briefly in turn. Firstly, looking at coalitions for scale. The World Report on Vision, which was published last year, showed that the scale of challenge that we face in delivering universal eye health is enormous. The World Report on Vision said that there are at least 2.2 billion people living with overt vision impairment worldwide. The latest figures from the Vision Loss Expert Group, which we've now published in the Vision Atlas in the past few weeks, show that there are 1.1 billion people who have vision loss worldwide. And for the vast majority of that 1.1 billion people, their problems could have been prevented or could be addressed. So that's an enormous number of people who could really benefit from access to universal eye health. And given that scale, clearly no one individual organization can do that on its own. We have to work together if we want to reach those 1.1 billion people who currently have vision loss worldwide. Secondly, and related to this, is to enable reach. So we know that the burden of eye conditions and vision impairment is not borne equally. It's often far greater in people living in rural areas, those with low incomes, women, older people, people with disabilities, ethnic minorities, and indigenous populations. 90% of people with vision loss live in lower and middle income countries, but we equally see many of those same inequities in higher income countries as well. If we can reach people who really struggle to get access to the services they need, we're going to have to work with organisations that enables us to reach into those different communities, whether that's working with schools and education authorities to reach children, or with local community organisations to reach indigenous populations. And I think the third reason that we need global coalitions is around really exercising our collective voice for influence and change. We know that vision loss is projected to grow enormously over the next few years if we continue with business as usual. And eye conditions are projected to increase across the globe over the next 30 years because of the aging population, with the impact of lifestyle and some non-communicable diseases, and of course the myopia epidemic, which isn't reflected in this slide. So in this slide, we can see that the vision loss is projected to affect over 1.7 billion people by 2050. If we add in the impact of myopia, potentially half the world's population, 5 billion people, will have myopia. So I think it's more important than ever to persuade governments and decision makers of the critical importance of eye health and of the importance to act now. And we're much more likely to have influence if we speak together with one voice rather than speaking individually. Of course, as a sector, we know much of this already, and there are already many examples of the sector working together in coalitions to address exactly these kinds of issues. I want to just take a couple of examples, first of all, to illustrate this. Firstly, I want to look at the International Coalition for Trachoma Control, ICTC, which, as its name clearly suggests, is a multi-stakeholder coalition of over 50 non-governmental, donor, private sector, and academic organizations working together to support the World Health Organization's Alliance for the Global Elimination of Trachoma, and working together to really, with the goal of eliminating trachoma worldwide. ICTC, the coalition, was established in 2004, and it's a forum for collaboration, shared learning, joint programming, and contributing to global efforts to eliminate trachoma as a public health problem by advocating for and crucially supporting the implementation of the World Health Organization SAFE strategy. And I think that's a really critical point, that together the coalition is working together to implement an agreed and shared strategy. This partnership has already seen significant success. By 2020, we've seen a 57% reduction in trachoma since 2011, but much more than that, a 91% reduction in the number of people who are at risk of trachoma since 2002. And over that period, and as of September 2020, 10 countries have been validated by the World Health Organization as having eliminated trachoma as a public health problem. And the coalition is working and is on track to really achieve the goal of eliminating trachoma as a public health problem worldwide sometime over the next decade. The second example I want to look at is one that obviously is even more familiar to me, IAPB, the International Agency for the Prevention of Blindness. IAPB is one of the oldest coalitions in international health. It was founded in 1975, and it was founded in partnership with the World Health Organization, where the World Health Organization, having come out of a very successful campaign to eliminate smallpox worldwide, was looking at other opportunities to look at conditions that could be eliminated, and was looking potentially at the opportunities around avoidable blindness. One of the lessons it took from the smallpox elimination program was that it needed a coalition of civil society organizations that it could work through in countries where it needed to work. And so it worked with inspirational leaders across the eye care sector to found IAPB. Since that time, we've now grown to really be the overarching global alliance for the global eye care sector. We have over 150 members worldwide, drawn from non-governmental organizations, hospitals, academic institutions, professional bodies, and the corporate sector. And critically, we are a genuine partnership across all those types of organization. We do a number of things. Firstly, we're the leading advocate for the eye care sector at a global level, working with the World Health Organization, as Vinod mentioned, in the United Nations, to really put eye care and eye health firmly on the global political agenda. Secondly, we look to connect knowledge across our partners and to share our knowledge across a range of platforms. We've very recently published the latest version of the Vision Atlas, the second edition, which is available through our website, which is really one of the most comprehensive and authoritative sources of data on the scale of vision and eye health worldwide. And thirdly, we work to support and strengthen our network, particularly supporting partnerships. And at the moment, we're particularly looking at using our convening power around refractive error to try to bring a global partnership together on that. I think crucially, throughout our history, IAPB has been a coalition for influence. That has really, in some ways, been the key aspect of our role that has lasted throughout. Most recently, we've been working firstly within the World Health Organization, where we supported the work to publish the World Report on Vision, and subsequent to that, lobbying and working with member states to develop a resolution that was passed earlier this summer, where member states signed up to implementing the World Report on Vision. And we're now working again with those member states and with the WHO to develop a further resolution which will set some key targets for the implementation of that World Report. And now we've expanded that to work particularly at the United Nations, where there's a thriving UN Friends of Vision group, looking at drawing out particularly the links between eye health and the Sustainable Development Goals. And there, it's very recently announced that member states are going to try to work for a resolution on eye health and its relationship with Sustainable Development Goals, which would be really a landmark resolution and would be the first time that the UN has acknowledged the critical importance of eye health to deliver those SDGs. But probably the best known initiative of IAPB has been Vision 2020, which I think I'm sure everybody listening to this talk is well aware of. Vision 2020 was established as a partnership between IAPB and the World Health Organization back at the beginning of this century to achieve the goal of eliminating avoidable blindness by 2020. And so to a huge number of initiatives, a number of high-level resolutions at the WHO led to the recognition of refractive error as a key component in delivering that goal of eliminating avoidable blindness. and there are many other elements to it. We, of course, have not achieved the overall goal of eliminating avoidable blindness, but that collective action that has brought organisations together from across the world and across the eye care sector has had a significant impact. And I think this graph is just illustrative of that in showing that without the work of Vision 2020 and the organisations behind Vision 2020, the problems would have been so much worse. And even though we have not yet achieved the goal of elimination, prevalence of avoidable blindness and avoidable severe vision loss has dropped significantly over the Vision 2020 period. So now I want to turn to some of the lessons that we've learned. We've learned from our own experience working as a sector together in coalitions, but also before I do that, I'd like to talk about one of my own experiences from working in the Foreign Office. And Vinod mentioned that I was responsible for counter-narcotics policy, particularly in Afghanistan, as part of one of the roles that I did there. And in that role, I led a global coalition to try to tackle the drugs trade in Afghanistan, with the aim of eliminating the heroin trade in Afghanistan over a 10-year period. The coalition was a multinational coalition. It included the US, Canada, and a number of countries from Europe, but it was also a cross-sectoral coalition. So it combined experts from law enforcement, from development, from the military, from justice, from a whole range of sectors, coming together to try to pull together a balanced strategy to tackle the drug trade. So that strategy included arresting and putting risk in for traffickers, to provide alternative livelihoods. You can see a picture of that on the left-hand side of the screen, where to provide opportunities for farmers to move out of growing poppy, but also where those alternative livelihoods have been provided, to put in place eradication so that there was a disincentive for farmers to grow poppy. And you can see pictures of both the destruction of some drug laboratories in these slides and the eradication force going in to eradicate opium poppy in various areas. We did have some success. We drove poppy production out of a number of provinces in Afghanistan and established possibly the most enduring criminal justice institutions in Afghanistan. But overall, the coalition was a failure. Afghanistan remains the hub of the heroin trade worldwide, and really we have had very little impact on reducing opium cultivation and the heroin trade in Afghanistan. Of course, this wasn't just all down to the failure of the coalition. There was very significant issues, obviously, within Afghanistan and the conflict there, which contributed that. But nonetheless, there were, I think, some lessons from the coalition and lessons that also relate to the experience we've had in ICTC and at IAPB that I think are relevant to the approach we take. Firstly, and critical, frankly, to all three of the coalitions I've described, is you have to have leadership and a shared vision. And actually, in each of these cases, I think that in fact was clear. We certainly see that in ICTC. We certainly see that commitment in Vision 2020 and IAPB. And in fact, we had the same commitment across the partners in terms of what we were trying to achieve in Afghanistan. But a significant difference, I think, was around whether we had a shared approach and a consistency in that approach. I think one of the lessons around ICTC in particular is that they have signed up to a shared strategy, the World Health Organization strategy, and behind that, there are sets of standards and approaches that all partners have signed up to implementing. And that has led to the success that we've seen in the trachoma space. In Afghanistan and the drugs trade, frankly, we didn't have that. A number of the partners wanted to pursue their own priorities. In particular, the US wanted a much stronger eradication-led approach. And that meant you put in disincentives while destroying the crops. If you didn't have the alternative livelihoods in place for farmers, actually all you did was create an incentive for poppy farmers to grow even more poppy the following year. That tension within the partnership and within the approach meant that we never really managed to establish a consistent approach to tackling the problem. I think a third lesson is around openness and listening and learning. And actually, I think this is a factor across all of these coalitions. That's certainly a lesson from ICTC, but frankly, that was a lesson that we learned in pulling together the coalition in Afghanistan, that bringing together different sectors and peoples with different experience did actually lead to creativity and to innovation and learning across those organizations. But I think alongside that, critically, it's important to set aside individual organizational interests and avoid duplication. And again, I think we see that in IAPB, where we come together to speak with one voice. And that means that the members of IAPB will allow IAPB to speak on their behalf rather than taking credit individually themselves. And within ICTC, many of those organizations were effectively competitors for funding, but they've now come together, and instead of competing with one another for funding, they'll put together joint funding proposals. That proved extremely difficult in the coalition in Afghanistan, where you had different countries with particularly different domestic political priorities, and being able to demonstrate that they were acting in their own domestic political interests often outweighed the priorities across the coalition as a whole. I think, frankly, the final lesson that we learned is that building these coalitions takes patience and a lot of hard work. You look at the timeframes we've been talking about. The ICTC has been around since 2004. IAPB has been around for over 40 years. In Afghanistan, we were given a deadline of 10 years, far too short to achieve the goals we were trying to achieve, but critically, far too short to build the experience and trust between the partners that can really lead to an enduring coalition. So I think you have to recognize that building coalitions absolutely does not happen overnight, that it takes time, and that you need to work together to build the confidence and trust to actually to have a sustainable and long-lasting, effective coalition. So looking ahead, and looking at the challenges then and opportunities that we might face within the sector, I think I point to three challenges and opportunity. I think I've labeled these challenges, frankly, they're just as much opportunities. And these are the three. Firstly, the cross-sectoral, building coalitions across sectors rather than just within the eye care sector. Secondly, engaging and working much more closely with the private sector as a partner and not simply as a donor. And thirdly, engaging and working with the communities much more closely, and again, involving them as partners in the coalitions we build. So let me briefly look at these in terms. Firstly, if we look at the building cross-sectoral coalitions, well, we know eye health isn't just a health issue. Improving eye health and eye care helps reduce poverty, deliver quality education, decent work, gender equality. I'll come back to the SDGs. It's in many respects a golden thread running through those sustainable development goals. We know it's not possible to achieve the sustainable development goals by 2030 without good quality eye care that's accessible to everyone. And what that means is that there are potentially many partners outside eye health who should be interested in the delivery of universal eye health. There's a challenge for us in persuading them to put it on their agenda, but if we can persuade them, they potentially offer opportunities to reach much more easily into communities and areas that may be more of a challenge for us. So that may be working with partners in education, working with employers, or indeed working with organizations on areas such as road safety. Again, there are many examples. I'm just going to pick one example of where we know when we're already doing this. And this is one. This is a Seeing is Believing project led by the Fred Hollows Foundation in Vietnam on Vietnam child eye care. And it was specifically set up to improve coordination between the education and health sectors in support of a national eye health program, school eye health program for children. And as a key part of that was strengthening the capacity of school staff and eye health personnel in schools to deliver eye care services for school children. It's been really successful. It's trained over 11,000 school-based staff on primary eye care and given access to 250,000 children to eye care services. So I think a really good example of what can be achieved if we work together across sectors. The second area I want to look at is around engaging the private sector. And as I say, engaging the private sector as partners, not just as donors. Again, there are already examples of this around. ICDC critically has pharmaceutical companies involved as part of their partnership. And those pharmaceutical companies play a critical role, obviously, in providing drug donations, but also in helping set quality standards that determine the overall approach for delivering services. Here's another one, and I think, and I do think, particularly in refractive error, partnerships with the private sector are going to be critical, because they will be critical, particularly for delivering the scale of services that we need. Indeed, I don't think it will be possible to reach the almost 1 billion people who need refractive error services worldwide if we don't work with the private sector. So here is one example, the Clear Vision Collective, which is a group of NGOs, social enterprises, the private sector, and indeed the government. And they're working in one district. At the moment, it's a pilot project they've just launched last year, and they're working in one district, Sherpur district in Bangladesh, with the aim to catalyse a transformative and permanent reduction in uncorrected refractive error and other eye conditions. And crucially, they want to do that by building working through the whole system. So on this slide, you can see that the aim is to work at primary, secondary, and tertiary level, and you see that the different partners will work and support at different levels. And the goal is not just to improve the quality of eye care services and deliver our glasses, but the aim is very much to improve economic development, income earning at household level, school achievement, and quality of life. So the aim is to dramatically increase eyeglass coverage and vision correction rates, reaching adults and children with vision correction over a 2-year pilot period, but principally using inclusive market-based solutions to sustain service provision into the future, with support for a charitable provision for students and skilled children and the ultra-poor. So it's a blend of market-based solutions, which is where the relationship with the private sector is critical, but also charitable provision for people who can't afford those market solutions. It began working last year, obviously has been impacted by COVID and the impact of COVID, but it has already begun to have impact. It's had over 41,000 vision screenings and over 20,000 glasses have already been distributed. Of course, working with the private sector, and particularly coming from the NGO sector, does present real challenges. There are challenges over values and priorities. And so I think it's really important as we build coalitions with the private sector and across sectors that we really tease those out, because those are the things that we found in Afghanistan was ultimately what undermined the coalition. So from the outset, you need to have conversations about those values, about the priorities. But at the same time, if you can work towards similar goals, then I think there are real opportunities here. And I think the challenge, and in a sense the opportunity for us, is to design business models that combine the reach and access that we NGOs bring with the ability to scale that the private sector brings. And as a result, to establish sustainable long-term access to eye care for populations who currently don't have it. I think to complement that, critically, we need to work harder to include the community voice as well. And again, many of those listening will know this well, that in terms of building the services that we provide, we need to absolutely engage with communities. And so in building coalitions, we need to find ways to bring that community voice into the coalition to understand local needs and the ways that can be delivered best to meet those needs. And in many respects, I think the lessons that we've learned from building coalitions elsewhere firmly hold true here. We need a willingness to listen, to learn, and openness to that. We have to set aside our organizational interests, and above all, we need patience to build trust in those communities. So I think going forward, there is much that we can learn from the past. Vision 2020 was a bold collective endeavour. It showed the power, it's shown the power and strength of the sector when it comes together. Of course, it's now drawing to a close, but the challenges we face over the next decade mean that the need for global coalitions remains as strong as ever. And those challenges are to meet the scale of need, the over 1 billion people with sight loss worldwide, to bringing together the range of skills and experience that enable us to reach communities that are difficult to access, and particularly to address the inequities that underpin that scale of need, and to speak with one voice to influence governments and those in power. And here a plug for IAPB. If you're not a member of IAPB, I would urge you to join us so that we can really enhance that collective voice. I do think as we go forward into the next decade, those coalitions need to evolve. We need to be much more open to working across sectors, whether that's the education sector, employment, and the economy, because eye care is not just a health issue. It's about economics, it's about education, it's about development. So we need to work with partners, persuade them why eye health matters, but then involve them and really develop partnerships with them. And then we need to work with the private sector, as I said, to bring their ability to scale services, but also to be able to work with them so that that scale also enables access to those services. And crucially, we need to hear and involve the community voice as well. In turn, we need to learn the lessons of the successful and indeed unsuccessful partnerships alike. It's not enough to have a shared vision, we need a shared approach. We need to be open to learning and to listening, and we need to have a willingness to put aside organisational interests, and above all, the patience, hard work and courage to deliver these coalitions. And if we have that, I think we can achieve the goal of leaving no one behind and providing access to eye care services for the 1 billion people worldwide who have sight loss now. Thanks very much.
Thank you so much, Peter, for taking the time and giving us such a rich presentation. Thanks for your leadership, and thanks for kind of going in a macro, practical, partnership-based way how things could be achieved. So if I may take a few minutes and just kind of ask you a few questions, if that's okay with you.
Sure, of course.
I was just wondering, are you working on any kind of coalition models on uncorrected refractive error? I mean, are you in the process of doing something in that space?
Yeah, so we are just beginning to explore. I think we're at the early steps. I think, so if I touch on what I was saying, I think refractive error is probably the best example of an area where we need to bring together the expertise that we have across the non-governmental organisation sector and the private sector collectively. In many countries, refractive error services are primarily delivered through the market, but at the same time, we know that an unchecked market can bring real inequities. So I think the challenge is to blend that focus on equity that the NGO sector brings with the opportunities to deliver at scale that the private sector brings. And so I think that's where the challenge is. And the challenge is really, can we design business models that blend those expertise, that mean that you can really have a sustainable service in countries that reach needs? So we have just begun to explore that with a group of IAPB NGOs who work across refractive error, and similarly with some private sector organisations to explore that. Now, unfortunately, we began this work at the end of last year, and COVID came along, and that has delayed. We have not been able to meet in person since February, and I think that poses a really practical problem. So we have not moved at the pace that we'd hoped. But we do hope that we will able to bring some form of coalition together, the intention will be for that to be quite inclusive and open, and be open to organisations across the globe who want to do that. And the aim is to establish something that can work globally, and really taking the micro experience that we've seen from the Clear Vision Collective to learn those lessons and establish that on a global basis.
And my second and the last question is, you've already touched on that a bit, with COVID and this whole process of living with COVID being, the norm, I guess, for the next at least, 2 years, I guess. What are suggestions you would have for people who do these kind of partnership building? I mean, what should they keep in mind?
Well, I mean, I think it's, well, the first thing I should say is that, I mean, COVID, of course, has affected all of us. And we're still living with it. We will live with this for some time, and we will certainly live with the experience and lessons of that. I know initially many people in the eye care sector will really across the world, eye care services stopped. Many people who worked on eye care moved over to the front line in tackling COVID, and we need to recognise the efforts people put into that. But now we are beginning to see eye care services starting up again. And so I think really one of the first things is to learn from and share experiences about how to get services up and running in a context which is really quite different to where we were 6 months ago. We've been doing some work at IAPB to try to pull that together, and we will be publishing some of those lessons on our website very shortly, so that there will be some shared learning around that. But I think just generally, when you're working in partnership, that actually just sharing those lessons is really one of the valuable things. I think the second thing I would point to is that there is a risk for us, I think, as a sector that the focus on COVID draws the focus away from eye health as a global political issue. We've had a lot of success in getting engagement at the World Health Organization and the UN on this, but naturally, governments are going to be focused on the immediate problem. So one of the challenges is how do we remind people of the critical importance of eye health? I think there are two elements to that. Firstly, it's reminding people that as countries want to build back after COVID, that eye health is going to be critical. It's critical to the economy, it's critical to education. And so it's a really core part of that development, of that rebuilding development. And it's quite simple. We know what to do. So I think there is a real role for us to speak collectively. So this is where the collective voice comes in, and the importance of the collective voice, that we speak collectively. I think equally, the third challenge in working together in partnership, which is the one we've experienced on the refractive error side, is that we can't meet. And actually, a lot about building coalitions is about building trust, building the experience of working together. If we can't physically meet, we can do a lot of this, work by Zoom call, and that does bring us together. It's certainly much better than having nothing, but nonetheless, it doesn't ultimately replace being able to meet together in rooms, and that's something that we're going to have to live with. This is not going to go away, and I think that probably puts a premium on our thinking in potentially different ways. So that's where, for me, thinking particularly about how do you engage at community level. We can't be there. I can't come out to different countries at the moment. So can we find organisations that are really working at community levels, who we can work with, who have the experience on the ground? And I think for coalitions which often work with international organisations that work at a global level, I think perhaps one of the big challenges to keep them going and keep them really successful is to identify community-based organisations that you can work with, so you can keep delivering what you want to do.
So thank you so much, Peter. Thanks for taking the time. I think the experiences you shared would be useful for so many people who are listening to what you're sharing. So thank you so much.
Thank you. Thank you very much.
Thank you. Bye-bye.
Bye.
Bye.